Our next speaker is Skylar Hill Jackson. Thank you, Skylar, and you'll have 3 minutes when you're ready. Thank you.
It would be nice if the counselors on their cell phones would pay attention, give us the respect that we gave you. The main motivation behind compulsory vaccine initiatives is herd immunity. The idea is that the more people that are vaccinated, the more protection there will be for the whole. The public health establishment borrowed the herd immunity concept from the pre-vaccine observations of natural disease outbreaks. Then, without any apparent supporting science, officials applied the concept to vaccinations, using it not only to justify mass vaccinations, but to guilt-trip anyone objecting to the nation's increasingly onerous vaccine mandates. However, herd immunity is undermined by high rates of vaccine failures, hence the growing call for more and more booster shots. Vaccine immunity does not equal lifelong immunity, which is acquired after natural exposure. The Quebec measles outbreak demonstrates that even a vaccination rate over 95% didn't prevent an outbreak. Herd immunity rates are based on statistical modeling and are only projections. The reason that 50% of measles cases occurred in vaccinated children is primary or secondary vaccine failure, which means the vaccine never produced immunity or the immunity was lost over time. For most vaccines, primary and secondary failures go unnoticed because children are not being exposed to most of these infections anymore. The infections children do get exposed to are whooping cough and influenza, and then vaccine failure is obvious because most cases of whooping cough and many of influenza occur in fully vaccinated children. In fact, health-compromised children are at more risk from the shedding of live viruses in vaccines by other children who were recently vaccinated. Studies show that the fully vaccinated majority are as likely to be infected with and can transmit diseases as the unvaccinated minority. Chickenpox cannot be eradicated both because the vaccine is not optimal and waning occurs, and because the virus stays in your body permanently after vaccination or infection. By the way, the UK does not vaccinate children for chickenpox because it is a mild childhood illness and they don't want a shingles epidemic. A peer-reviewed research paper titled Herd Immunity, History, Theory, Practice concludes that the science behind the herd immunity theory is not settled. 2 U.S. legal scholars have shown that 60 years of compulsory vaccine policies have not attained herd immunity for any childhood disease. It is time to cast aside coercion in favor of voluntary choice. Perhaps Toronto Public Health would be wiser to spend more time, energy, and money on proven health outcomes like ensuring children have access to nutritious food, helping families understand the disease prevention benefits of breastfeeding, helping families reduce their exposure in environmental toxins, and so on. You may choose to look the other
just
way,
wrap up in one sentence,
you can
please.
never say again that you did not know. I will not consent.
Thank you very much. Are there any speakers for questions for the deputant? Seeing none, thank you. Our next